I'm sitting next to Wendy, who's been a long-time patient, both medical and cosmetic. She's easy to work on because she's so darn pretty to start with. I mean, you know, I don't think she needs much, but hey, who doesn't want to look a couple years younger and have lips that are a little bit more full? So today, among other things, we're going to enhance her lips a little bit. Now, if you look at her lips right now, they look pretty good. And she has the typical Cupid's bow with a little up here and down there, and it's very slightly asymmetrical. This side is a little higher than this side, so I might give her a little bit more over here. If you look at her lower lip, it looks good. Basically, it's sort of the classic pretty pair of lips, but she wants a little bit more. As we get older, what do we find? We find that this part here, that red border is lower, so you see less red lip as we get older. All right, so as discussed, we're going to do the little intro needle. This is just a poke. And then we're going to use this needle entry hole to do our catheter cannula business. Open slightly, please, Wendy. Okay, on 3 a pick. 1, 2, 3. Okay, we're in. Remember, this is not sharp. And I'm going to feel. And that just slid real easy, which means I'm in the right place. And I'm injecting slowly. Having much pain, Wendy?
I know.
And we can see that we've enhanced her lip already, and that looks good.
No pain.
Okay, so we're going to go to the lower lip now. Open a little. And I like to give a lot of the product on the inside near the teeth, and people say, well, why do you do that? It looks understated. I want her to be in the shopping mall or the airport in a week and nobody knows she's had anything done. They just say, what a hot set of lips. Now, you can see that she's got real nice lips, and we've used just about half of our product. I'm going to go to the other side, do that, and then we're going to use a needle for some touch-up in just a moment. And the area I'm looking for is right along the lip fat line, because the lip has some fat. I want to be right between the fat and the muscle, which is where I'm at. I think she looks good. A little bit on the bottom now. Open. How much pain you having, Wendy?
None.
I think she's being too nice to me. The key is to try and go along the vermilion border right here with this stuff on the lip. It enhances the border of the lip. Now, let's see what you think, and then we're going to give you a little bit more. So I'm going to clean her up, and then we're going to do around the world. Around the world is this. Open up wide. I'm going to come in here and come around the corner and inject there. Now, if you look at Wendy's lips, she's got a little bit of a crease here. We call that the oral commissure. And if you look at the oral commissure in a 15-year-old, it's a little bit more like that. So we're going to add a little volume there, and that will decrease the oral commissure, and it'll also add a little volume up here where we tend to need it as we age. Okay, so here we go with around the world. We're going to give her just about a tenth or maybe a little bit more. And the important thing is to curl around and get close to the lip surface as you do this. Look at the camera. That's a nice set of lips. Take a look. What do you think?
It's perfect.